Hi everyone, and welcome. This is my last and final project for Nursing 442, Leadership and the Future of Nursing. I'm kind of excited to be at the end of this road for this class, although the class was very informative about how to build up a leadership role. For my topic for this project, I chose to talk about the future of nursing. And during my presentation, I hope that I can get across to you how it is important that we strive to get that 80% of the BSN prepared nurses in the field by 2020, and how a residency program could benefit new graduate nurses and promote retention and patient safety, and also the importance of trying to achieve that lifelong learning and knowing that in the nursing field you have to be a lifelong learner. It's something that is expected. You just can't go to school and then expect to be done and then you're done with your education. Your learning is going to continue throughout the rest of your career and even the rest of your life. So it is very important that the nurses understand that coming into this field. So let me just give you a little background history on the IOM report. The IOM report was started by the Robert Wood Johnson Foundation and the Institute of Medicine. In 2010 it was written. Those committees combined to come up with a recommendation on how the healthcare should be now that President Obama signed the Affordable Care Act back in 2008. So they came up with 4 key messages, and then from those 4 key messages, they built upon 8 recommendations. I don't know the 4 key messages by heart, so I'm going to kind of go off of my notes here. So sorry for looking at my notes, but I want to make sure that I'm explaining everything right. So the first key message is that nurses should be able to practice their full extent of their education and their training. Number 2 is nurses should strive to achieve higher levels of education and training through an improved educational system that promotes seamless academic progression. Number 3 is nurses should also be full partners with physicians and other healthcare professionals in designing the healthcare system in the United States. And lastly, to promote an effective workforce, planning and policy making, better data collection, and an improved infrastructure. So those are the 4 key messages that were built upon the IOM report. From those 4 key messages came the 8 recommendations. I will only be discussing 3 of those recommendations. The top 3 that I feel, as I'm going to school to be a nurse educator, I feel that these are the most important in my field that I want everyone to be aware of, and that we should all work towards getting this, completed by 2020, or if not, pretty close to being where the goal needs to be. So, my first recommendation would be to talk about how to achieve the 80% of the BSN prepared nurses by 2020. So let me just start by, when I was reading an article titled 80% by 2020, the present and future of the RN to BSN education, it stated that 80% of the 2020 goal, you will need 2 things that need to occur to achieve that 80%. First of all, you need to build up your RN to BSN programs, which they are gradually building up and they are coming, but the problem is with that is they're coming so fast and you need the right accreditation. A lot of the programs, the RN to BSN programs, are not very accredited, so it is important that the RNs who are going into these programs are checking that out, because that could be a hindrance for them in the future. The second conflict that they're going to have to deal with is to increase the number of graduates from the RN BSN completion program. Right now, the graduates from the RN to BSN completion program are only at 40%, which was reported back in 2011. So it's 2016, almost 2017. That needs to increase really within the next 3 years. And unfortunately, to achieve this goal, there's going to have to be almost a doubling of people graduating from the RN to BSN program. And like I said before, if you have the RN to BSN program and it's not really structured, and they don't tell you to take this class or this class as a prerequisite, or they're kind of throwing things out and making it really fast and really easy to get these people to their BSN program, it's going to hinder having a BSN, and it's going to put a bad name against the BSN, that so many people are going through these programs and they're really not showing any difference from not going through the program. They need structure. All the RN to BSN programs need to be the same. There needs to be some type of committee that needs to talk about how and what needs to be consistent through all the RN to BSN programs. This could be involved like the educators. This can involve the state of the boards. It could involve the directors, the educational directors. Just some type of committee so everyone's on the same page. That's pretty much what I got out of that article. But let me go through a few other things. In regards to this being achieved, like I said before, the number of the RN to BSN programs must grow by much greater numbers than the current capacity allows. Plus, the number of graduates from the RN to BSN programs would have to equal that of the regular BSN program graduates, which is kind of hard to achieve if you're running people through. It's going to start running like a factory, and it's not going to be good. Let's see. Now, because there will be a proliferation of the RN to BSN programs, there needs to be some type of consistency, like what I was just explaining, between the requirements and standards. Otherwise, the program quality will vary, and ultimately making the BSN degree lose its value, and no one wants that to happen. A study was done using a descriptive design, and a survey was administered to all RN BSN programs throughout the United States via the internet, and which turned out there is 614 RN to BSN programs currently. This article was back in 2011. So back in 2011, there was 614 RN to BSN programs. Out of the 614, only 192 finished the survey that was handed out, which is not that much out of 614. The survey asked the questions on how students have changed over the course of the RN to BSN program, what types of significant challenges appeared for the nurses in the RN to BSN program, and what kind of prerequisites were required. So how the students have changed in the results of this study basically explained that they did acquire a greater knowledge, and they were able to have the deeper critical thinking that they needed. But some of the limiting factors or challenges I can refer to. If you refer to my handout, the first table on my handout will tell you about the limiting factors and most significant challenges. those are going to be the time to commit to the program. Finances, the expense of the program, unfortunately, it can be quite expensive, as everyone knows from attending this program. You have to have the money and you got to pay for your education, which is a whole nother story. Personal and family issues. If you have a family, you're trying to balance your work with your family, which I happen to do, and it gets crazy. I work full time. I have 2 kids, a 5-year-old and a 5-month-old. That's why I'm locked myself in the bedroom right now to give this presentation, because otherwise it would be crazy and we would hear kids running around and screaming. So sorry about the whole background here, but you gotta do what you gotta do. The next one is computer literacy. If this was an online RN to BSN program, are they computer literate? Are they able to work from a computer? Do they have the skills needed to surf the internet, to research articles, to be able to use Blackboard or some kind of educational platform, kind of the online learning type? Are they able to do that? Most older nurses aren't able to do that. So if it's required to have your BSN by 2020, most of the older nurses are probably going to retire and they're not going to want to go back to school to get their BSN. But the younger generation will do just fine to do the classes online. Motivation. How motivated are you to obtain your RN to BSN? You have to have that motivation. You have to have the motivation to learn, to motivation to just even get into school, to want to learn, to want to succeed, to want to achieve that higher education, your BSN or even your MSN. That is something you have to want. The last one is your knowledge base or preparation. How knowledgeable are you as a nurse right now, or how prepared are you to go back to school? Have you been out of the field for a while and you want to return? That could be a significant challenge when trying to go back to school to get your BSN. So those are some of the significant challenges when you're facing trying to go back to school. So some of the prerequisites too. So I noticed when I was reading this article, not all the RN to BSN programs require all the same prerequisites. And this is where it gets a little hairy on having them be consistent. So you could have, Sally over here in Washington take their RN to BSN, and she didn't have to take her chemistry class. It wasn't required part of that. She didn't have to take a nutritional class or a class on nutrition, but other people did. So how does that prepare her versus, Jane over here in Wisconsin? So that has to have a consistency, I think, throughout. That's something they need to work on. I do see the number of the BSN programs will affect nursing. I do believe that people should strive to get their BSN once they have their ADN. Once you get your associate's degree, keep going. You don't want to stop. This will only help you in the future. You need to have that strive to keep going, because once you stop, you're going to kind of lose your mindset and you're going to want to not go back. You just have to keep going. This will impact nursing greatly. It has been shown that having your BSN will help patient safety and it will help patient outcomes. That BSN nurse has the more critical thinking ability, and it has been shown statistically that it has saved more patient lives. So that is why they're trying to require everyone to have their BSN by 2020. I don't believe that I know of any state legislation in Wisconsin right now that requires you to have your BSN by 2020, but I have heard people talking about it. It's been talked about in my organization where I work. They've always talked about, it would be nice to go back to school, get your BSN. And a lot of the clinical groups that we are accepting through the organization are not from the technical college that is local. They're taking the BSN programs from Milwaukee. These kids are coming down all the way from Milwaukee because they want to retain these student nurses because they will graduate with their BSN and they'll already have it and they won't have to, wait to build up their BSN nurses. So that's why they're kind of bringing that in and then kind of weeding out the ADN. That's how I feel, and I think that's how they're playing the game. And again, refer to my handout for the limiting factors that I've discussed. Okay, so the next recommendation on the IOM report that I feel this is like my passion that I want to do is create a nurse residency program. I feel that so many nurses come into the field and they are not ready to transition from that role of the graduate nurse in school, and they're taking everything you learn from school and then trying to go to the field where this is reality now, so it's way different from what you learn in school. So you kind of gotta separate those two, and you need a type of transition period to get you to where you need to be. It is very overwhelming. I know I was once there myself, and there was days where I would go home crying because I'm like, I can't do this. And I went to nursing school and I'm never going to be able to do this. This is crazy. What did I get myself into? So a residency program is something that I really want to create at my organization. Right now we only have a standard 4 to 6 weeks of orientation that the nurse gets. And basically the nurse works with a preceptor, and it's just not one preceptor. It could be a few different preceptors. And it depends on if their preceptor is any good, really. You kind of hope that they do get a good preceptor because then that will help them along the long run. But if they don't, they need this residency program, and I cannot wait. Hopefully when I'm done with my master's degree, they will let me create some type of program, or even after I get my bachelor's degree, I'll be able to do some program development and kind of push my thoughts onto the upper management. So we'll see what happens. So when I was doing this research, I did find an article on new RN residency program and the transition to effectively transition and safely transition into their new role. So this, new graduate nurses often lack clinical skills needed to transition efficiently and safely from academics to the bedside practice, which I just explained. You think when you are in nursing school and you graduate, you think you're going to your job, whether it be in the hospital or an outpatient setting, and you think you know everything because you graduated, you passed your NCLEX, you think you know everything, and then it's very kind of hits you in the face, brings you back to reality. You get a nice reality check. You really don't know everything, and you need that transition period. The stress level and the feelings of incompetence tends to lead to a higher turnover rate, which could also lead to not providing safe patient care. These nurses are leaving because they're very overwhelmed. They don't think they're competent enough, and that's leading to a nursing shortage, which we already have, and the nurses are then having to take more and more patients on. This could also lead to providing unsafe care because the nurse doesn't feel competent enough and makes a mistake and does an error. Hopefully it doesn't involve a significant error where it involves patient death, but that's probably happened. So I believe this needs to happen at my organization and probably many others. I haven't heard of any nurse residency program within my local area, so I'll be excited to hear about any residency program that anyone has so I can kind of take what they have and learn from it and kind of build my own. So like I was saying, in one of the research articles that I found I was reading, it was titled The New RN Residency Program to Improve Clinical Competency, Confidence, Socialization Skills of Novice Nurses. They reported that 17.5% of new nurses left their first job within 1 year of starting. And then just the expense to have to orientate that new person on the job and then having them leave, this could cost a lot of money. In the article, they quoted $96,000. Think of that. How much money could they save if they had a residency program that would help build the confidence and competence of these new nurses and increase the retention rate instead of having all these people leaving even after not even a year? It could save a lot of money for the institution or the organization. Let's see. In the study, they used a descriptive design and they used questionnaires and surveys to guide the novice nurses and preceptors before they started the program and when it was completed. Out of the 238 participants, only a sample of 114 completed the criteria, so they had to be in the program and want to complete the surveys. Based on the results from the study, there was not one RN who disagreed that attending the program and helping them to feel more confident and competent, it's going to work no matter what. You give them a little program, give them some education, spend that mentoring, the coaching, spend that time with them, run some videos, do some hands-on skills, have a skills lab that they can go to. I got all these ideas I could start giving you. And it will help. Any little bit will help. On my handout, I also have a picture of the transition stage model for the new nurse. So here you have your orientation. Then you're doing and transitioning your shock phase. You're a new nurse. You're going into the field. You're shocked. You're overwhelmed. You feel incompetent. Then along the road, 4 or 5 months later, you're transitioning from that shock phase into like the knowing phase where you're feeling a little bit more confident. Not as much competent, but a little bit more confident in your new role. Then 10 months later, you're 10, 11, 12 months later, you're a year later into this. You have that confidence level. You have that critical thinking ability, and you feel more competent. I'm not saying that the residency program should last a whole year, but on this model, on my handout, it shows from 1 month to what 12 months looks like as a new nurse. I would suggest a residency program only going for 12 to 15 weeks. The last topic I will be discussing is the importance of achieving lifelong learning. As a nurse, meeting the challenge of lifelong learning will require change the way teachers teach and learners learn. This will take more responsibility on the learner to set their goals, identify resources for learning and reflecting throughout your life. Education cannot be envisioned as a finite thing. It is a preparation for life and must be viewed as part of a whole life itself. However, there are going to be barriers to lifelong learning. This might be lack of motivation. You don't want to learn. You don't feel like you need to learn any more than you learned in school. Time, like I said before, no one has a lot of time. Adequate resources could interfere with individual success as a deep independent learner. Lifelong learner could also at the point of care. But many times critical questions often go unanswered because lack of convenient access to reference materials. So basically they're saying lifelong learning should be at the point of care. You should be learning as you're doing. That is what the Joint Commission actually suggests as well. In the research article I was reading titled Lifelong Learning in Nursing, a Delphi study, they collected information from 38 respondents on characteristics or behaviors as a lifelong learner and rated these characteristics and behaviors. 1, they disagree. 5, they agree. Then they were asked to identify which were important to the experience and the development of lifelong learning. On my handout here, I have Table 1 and Table 2, if you want to refer to that. Basically is what the respondents came up as the lifelong learner ratings, what they need to have as a lifelong learner. Then they came back and agreed on a set of them, and then they went back and rated them as to what the lifelong learner should have. So those are what those 2 tables explain. After the study was concluded, it was clear that the responses from the lifelong learning does make a difference in nursing and education and practice. All learning should be approached from the perspective that learning is a continuous and finite process. So those are the 3 articles I have researched. I also have on my handout suggested learning activities for lifelong learning. Those I just put on there because they go along with the study. I'm not going to read those to you. Those are there for your references. So let me just kind of summarize what we just were talking about. So the BSN by 2020, 80%, it needs to happen, and I know it will get close. I don't think we'll hit the 80%. But it's worth a try. Residency programs are a good thing. They need to happen. We'll see what I can do here at my organization, and hopefully I can help that problem out a little bit over the next year and a half. And lifelong learning. Lifelong learning needs to happen all the time. It needs to continue. Learning needs to continue. As an educator, I push for learning. Hopefully I can teach one day, but for right now I would like to develop this residency program first. So that's pretty much my presentation. Hopefully I didn't ramble too much. I hope you enjoyed it, and I look forward to being able to participate and bringing about a better future for nursing by 2020. Thank you.